Family nurse practitioner Debra Middleton started working at the Cooperstown Medical Center as a locum tenens. Locum providers typically work for a medical organization, filling in when other healthcare providers are absent. However, even though she lives more than 2.5 hours away, Middleton found a home away from home at Cooperstown Medical Center.
She could have a big job somewhere in a big city, and she chose us, and we're glad she did. And I think she deserves every award she can possibly have because she really deserves it. She gives back to the community.
Her peers on the medical staff committee appointed her as the clinical care coordinator. In addition, she's spent the last 2 years logging hundreds of hours in the emergency room, where she gained experience and knowledge in emergency room care.
She really makes connections to people, makes them feel heard, and she's also continuing her education to make sure that every time she comes across a patient, she's offering the very best she can.
Deb is really the heart of Cooperstown Medical Center. Everybody sees her as a great provider and have had so many wonderful things to say about her. And as a loyal patient to her and Cooperstown Medical Center, I feel that she's such a great asset to us.
Middleton has a calming bedside manner and makes her patients feel comfortable and safe. Even when patients are referred to other facilities or specialists, she personally follows up and checks in with them. Staff and patients marvel at her ability to switch between routine healthcare and emergency situations with sincere empathy.
It's not easy spending time as a rural healthcare provider. You don't have a specialist just down the hall or a colleague to bounce things off of unless you get them on the phone, which isn't always easy. Deb's made the commitment not only to her patients, but to that community to keep healthcare there and to keep it a going concern.
Middleton could have chosen a larger health system in which to practice. However, the Cooperstown Medical Center staff and her patients are glad she chose to share her expertise and passion with their rural community.
I'm very honored that my peers nominated me and some of my patients. I accept the award on behalf of myself, but more importantly on behalf of all of the team that we have working here. I have always felt that it's very important to be diversified because our patients in a rural setting are really reluctant to go to a bigger city. And so I've tried to have a broad skill set and learn more skills than I probably would have had I stayed in a city setting.